When you typically picture a baby being fed a bottle, usually you have the image in mind of mom nestling baby in the arm, holding the bottle like this, and feeding the baby in this kind of cradled position. And although that's a very sweet, loving embrace for a baby, it's really not conducive to bottle feeding at all. What happens when you take a bottle and tip it upside down is the milk just kind of drips out from the bottle. And what happens when you have a baby on their back and a bottle tipped upside down in their mouth is the milk just kind of drips out really easily, and it gives the bottle control of the feeding. And ideally, you want to have baby in control of the feeding. This is especially important for a baby who is breastfed. So let's say you have a mom who's going back to work. Well, sometimes what happens once moms leave baby with their care providers, baby gets used to a super fast pace in a bottle when they're being fed, baby on their back, bottle in their mouth like this. And when it comes time to going back to the breast, baby starts to get frustrated with the breast. The milk comes out pretty slowly at the breast usually, and they have to work for it, whereas when they're in this cradled position, the bottle does all the work for them. So babies get kind of lazy and they get a flow preference for that bottle. So if you can feed baby in a very paced style of feeding, it allows them to have to work for the milk in the bottle, and it allows them to be completely in control of that bottle. So it's important when you talk to your care providers who are going to be giving the bottles to your baby, and make sure that they are aware and understanding of feeding cues, and especially what your baby's feeding cues look like. When you are giving your baby a bottle, you want to completely follow their lead, follow their feeding cues. Don't just stick the bottle in their mouth. Put the bottle near their lips and let them draw the bottle into their mouth. And then every time you give them a break, wait for them to be ready for the bottle and draw that bottle nipple back into their mouth when they are ready. So what I'm going to show you now actually is a video of my good friend Victoria feeding her 5-week-old daughter Jenny a bottle. And she's going to demonstrate the proper way of paced feeding, which involves having your baby sitting as upright as you possibly can get them, and keeping the bottle level to the floor so that only the nipple of the bottle gets filled with milk. Then what you want to do is actually give baby lots of breaks during the feeding and let that feeding stretch out so that it takes 10 or 15, 20 minutes to drink that bottle. What you're going to notice is that every single time you give baby a break with the bottle, they're going to want to take a little bit longer of a break, a little bit longer of a break, a little bit longer of a break, and eventually they're going to stop wanting it. So now let's take a look at Victoria and Jenny and see what paced bottle feeding looks like in person. That's paced bottle feeding. It's really simple. I hope you guys enjoyed this video. I hope you found it helpful. Have a healthy pregnancy and easy breastfeeding.